Stacey, shall I just hand over to you for a quick recap from the last meeting, which was just before Christmas?
So it is a quick recap as well. So what was mentioned was concerns around sort of the vaccine in the men's and the women's group, and talks about some further work needing to understand the concerns and increase the confidence. The Health Watch survey around the vaccine, that is still open as well, so we'll share that link. So underrepresented from Black, Asian, minority ethnic groups and young people. So if anyone works with those groups, if they could share that survey, and we'll try and capture as much as possible. There was some talk around increased referrals, but not just that, more complex referrals that were being received, and also a reduction in services to signpost those people to. So people felt that they were keeping those people that they were supporting longer than what they would normally keep them. There was free PPE to families who were visiting care homes, and Carers Leeds, they shared some links to for more information and how to access that. There were talks around the second national lockdown, and now we're in a third national lockdown, and for the migrant, refugee and asylum seekers, that the all-in policy that was for the first lockdown as a national policy, that wasn't being something for the second lockdown. But Leeds took a local approach to be able to house temporary housing for those people and offer support around physical and wellbeing activities. And Wendy also did a talk on human rights, which was really informative, and the recording we've got back now, and that's on our website. So I'll share a link with that for anyone that missed it.
Thank you, Stacey. That's really helpful. Shall I say a little bit about the, just to give us that kind of picture of where things are? Obviously, we've gone into the third lockdown, and you'll all be, massively aware of all of the impact that has, both in terms of communities and provision, and, the practicalities of that from supporting people and all of the kind of work that organisations that you're connected with are doing. Obviously, issues around schools and hospital capacity have been very significant. And I think what we have is a sense of the city continuing to work really hard and really working as a sort of system partnership around that, and to really trying to have those kind of positive solutions, and people working generously between different organisations. Challenging though the situation is, that does seem to be a real positive thing that's helping us in the city. The current actual kind of infection situation is we've seen a slight decrease in recent days in the overall infection rate and positivity over the weekend for Leeds, but it's too early to see this as a trend, and obviously nobody can afford to be complacent, particularly because we do know that around a fifth of cases that are being seen in Leeds are the new variant. And again, you'll all, I'm sure, be very aware of all of the concerns about just how very contagious that is, and some of the different measures that, obviously all of the basic measures all apply, but even more so because of that additional infection rate. So the overall case rate is now at it's 332.6 per 100,000. So it is slightly down in the last couple of days, but still up 30% over the last 7 days. So really not to be complacent. The over 60 rate, which obviously is a concern, for all of those kind of health reasons, that's fairly stable at 209, and positivity rate, it's 13.3, but that is still very high. So although things are very slightly better, it's still a kind of concerning situation. And the average rate for Yorkshire and Humber is 317. So just again, sort of, in a difficult situation, but some positive news in that. In terms of I think it's worth just mentioning around some of the work around vaccine and the test and trace work, and also lateral flow briefly. So in terms of vaccine, one of the things that some of you who've been to this meeting previously will know is we've really been trying to ensure parity of third sector frontline health and care workers for vaccination. So we've been working very closely with other people across the system, and we are in the process of establishing a booking system. So that principle that third sector frontline health and care workers should be vaccinated along with social care and that whole kind of group of workers is absolutely accepted, and we're in the process of agreeing the system where organisations will be able to book. So that will very much be the workers that are doing face-to-face work, with a priority on the few, comparatively, I think, probably in the third sector, who are doing very personal care, so very intimate physical care for people, will be the very first group of workers, with lots of workers from the third sector in that second group, which will only be a week or so behind. So that will be all sorts of workers that are providing care and support for people who are homeless and older people, and a huge list of all of that. And we'll send out a detailed email that kind of gives that the specifics for that. But just to be assured that we're working to make sure that we've got that booking in place first. What it will be is there will be a whole batch of options to book vaccine slots that will be released all at once. So we're trying to make sure that it's all fair and out there, and that everybody has access to that in one go, rather than things happening in dribs and drabs. So we will make that available, and we're working very closely with Adults and Health in particular, because they're commissioned services from the third sector. They're also putting messages out. So we're just trying to avoid duplication and make sure that we're capturing everything that's happening, so that we can make sure that people aren't missed. So we're working very hard to make that kind of fair, and that everybody that reaches everybody. It is worth just pointing out though that PCNs, so the primary care networks, they're getting batches of vaccinations. So it may be that in some areas they are reaching people and contacting people directly. Obviously, so that vaccination that they're prioritising is obviously the over 80s, and they're working through, and hopefully you will have seen from our website the information about the way in which they're working through for priorities for age and the various categories. But occasionally, some of them, because they all get the same number of batches, some of them may get to some people before other areas of the city. So just to be aware that there is that broad prioritisation, but occasionally, it may seem a little bit different from that, and that will be because of local variation. And I think the reason for mentioning this is I think it's important that we all understand that everybody in the system is working really hard to make this fair and organised, and to work through the priorities. But also, nobody wants to waste vaccines either. So if there is some variance, it will be for those kinds of reasons. So to give that message of reassurance, that will be happening for a good reason if it's happening, and that we will be getting to everybody in time, and that we're continuing to try and make sure that the information is flowing so that everybody has that. So I think that's the current situation around vaccines. Keep an eye on our website, Daisy and Stacey, making sure that we've got that kind of information up there. And if people have got particular queries, we're more than happy to answer those. But we will get the generic information out as soon as we have it, and we'll make sure that everybody that's on this list gets that. In terms of the sort of test and trace and all of that work around sort of door knocking and follow up that we've mentioned previously. So the 3 Better Together public health contract organisations, so Barker, Health for All, and Orion through Feel Good Factor and Touchstone, they're working on some of that in local areas, just so you know that is ongoing and being developed, because that sort of personal follow-up and support is really important. And the other thing I should have mentioned actually as well is there's also some information about the take-up of self-isolation payments. The success rate of that is around half, so 52%, because that was the other thing that in Leeds people have been concerned about, making sure that people who need to self-isolate have are able and can afford to do that. So Public Health are working with other people in the council to make sure that people have got access to those £500 payments and support. And then the final thing, so lateral flow, there are a couple of things to say about that. I think we have had some conversations about piloting lateral flow testing in the third sector, and we've had a couple of organisations that have come forward interested in doing that. But meanwhile, there is now a conversation about having a central hub for the third sector workers to access for that. So I've had an email just this morning from Sharon Foster, who says they're just in the process of setting up the mechanics for that. And again, she will let us know as soon as we know what that is, and we will let people have that information. We've discussed lateral flow, I think, before, enough to understand that, it's not a perfect, it's not going to suddenly answer lots of things, but what it does help to do is pick up people who are asymptomatic, and it's one of a multiple range of things that gives some assurance and a kind of safe process that third sector should have the same right to access if they want to. But it comes with a bit of a recognition that it is a lot of time and resource, and people need to weigh up to what extent they want to go down that route. And if anybody wants more information on this, drop us an email and we'll make sure you've got that. So it comes from a point of that sort of parity of people working in the third sector have got the same right to access that as other workers. That is absolutely available to you if you want to go down that route. And also, as you'll know again from the news, there's conversations about that happening in schools. And there is a suggestion about some volunteers and linking in with voluntary action leads to help make that happen for schools. So we can let you know more about that as well. So those are some of those issues. As ever, messages on our website about the social media and other messages to share. So that is all available, and we'll make sure every Tuesday we send a weekly email out to this network, and we'll make sure that all of the current links, as ever, are on that. So does that help, just to give that bit of an overview? I'm not seeing any specific questions. Jag made the point about other people have been doing some of that door knocking. It has been happening already, Jag. It's not that it hasn't happened at all yet in Leeds, but it was about us working up a process that was a bit more consistent, trying to get those things right and work with the networks we've got. But I think other places went down a route of doing that through local authority staff and other people. I think what was trying to happen in Leeds was using trusted local organisations to be part of that delivery and to do that in a planned way. Any other specific thoughts or questions, or should we go through, do some quick introductions? We might just ask people to just do a quick 1 or 2 minutes, where you're from and a couple of the key issues that are of concern or that you'd like to share with the group this morning. Should we do that? If we go through, I'll go through my participant list. So I'm going to start with Jen. Jen Bravo is the first on my list. Morning, hi, Jen. How are you?
I'm Jen Bravo. I'm Services Coordinator for TLA. Brief update. We're just still managing with the update, managing with clients. Some of the young people still maintain this is a hoax. So staff are just dealing with that, but getting on with things, really trying to balance the needs of the service versus being in lockdown. But it's same it's been for months.
Thank you, Jen. Yeah, it is relentless, and we completely massively appreciate how hard everybody's working to just keep standing still and to keep going with all of the challenges. Thank you.
Thanks, Chris.
Steve Taylor, who went to the same primary school as me, I have to tell everybody, for no good reason.
That was a wonderful link, that. And there's a different world as well back in the West Midlands, the wonderful West Midlands. Morning, everyone. I'm deputising, if that's the right, for Rachel Moore from Carers Leeds. So Rachel's been coming to these meetings. She's another meeting this morning, but we'll be here for the next one. Carers Leeds have, obviously, like all of us, have continued to be open for business, so to speak. But we have seen a drop in people contacting our service, which is always a slight concern, particularly carers being, I think, more potential to be much more isolated during lockdown arrangements and restrictions, particularly from fatigue and burnout, is things that we're hearing coming back. A lot of conflicting information, and know what to do with that information, and just that uncertainty and loss of control about home life, caring, working, all a bit blurred for people. So these are kind of big themes that we have coming through as well. What we've tried to do is, I'm sure we've all experienced this sort of digital inclusion of how do we get people to engage in activities like this, that otherwise if people aren't digitally included, then they're going to be maybe more isolated from that. So we do a lot of work around digital inclusion and got some support and some devices to help put out to people. So hopefully we can collaborate on a lot of that sort of approach, really, because it's all about partnership working, getting that digital offer out there for people. And I think one of the biggest sort of things that we've tried to do, and we'll be doing again, what we have done and we'll be trying to do again in March and April, is to get out our physical newsletter. Up until this date, we're having just a lot of digital sort of distribution for people who can access emails and that sort of stuff. But we're aware a lot of our carers aren't able to do so. So we've actually, by getting out of paper copy to 11,000 people in itself is quite a logistic challenge, but we did so. We did see an increase in activity to our support line, which suggests really that people are still engaging through traditional paper copies, conversational approaches. So that's kind of the feedback from Carers Leeds.
Thanks, Steve. Yeah, really important, those issues around digital inclusion, exclusion and unpaid carers. Thank you for that. Abigail, welcome from the Forum around Cultural Diversity and Voluntary Action Leeds.
Morning, Pip. Hi, everybody. Just in case anybody hasn't met me yet, I'm new to post, project worker for the BME Hub, taking over Annette Morris's role, but she's still within the organisation. Just a brief update from us. I think the vaccinations and everything is still a priority for us. I'm sure for everybody else moving forward in 2021. We are happy to work along, organisations as a sounding board for any projects, surveys, or just anything at all. You can. The hub is there to kind of give the opinions or voices from culturally diverse communities. And yeah, if you have any information, we do have bulletins and things running weekly. So please, send that over, and we're happy to share with the network. So that's it for now, but I'm sure there'll be more to come as well later.
Oh, thank you, Abigail. Yeah, brilliant. And I think, the hub has been such a kind of key contributor to this work and to linking across. And if anybody hasn't got that connection already, that's really great to kind of hear that kind of welcome opportunity for people to link with you. So thank you for that. Ali next from Leeds Older People's Forum and Neighbourhood Networks. Hi.
So my role is to work with the 37 Leeds Neighbourhood Networks. The neighbourhood networks have been really, really busy since we went into lockdown, and they're sort of fully focused on meeting the needs of older people during lockdown. So many of them have gone back to food deliveries, activity packs, but they're really pretty full on at the moment. And obviously they're involved in the vaccination process, working with their members to coordinate local vaccine efforts as well. The other thing to note is that tomorrow on the Leeds Older People's Forum, we'll be launching the second round of older people's COVID grants. This money is from Public Health and is available to all third sector organisations. For those of you who might have applied during the last round, the process is the same. It's very, very simple form. The priority groups for the second round are older, isolated, vulnerable men, older people from culturally diverse communities. They're the two main groups. There's a couple of others that are quite generic. The focus of the grants is all about getting public health messaging out, and the money is to be spent as soon as possible because it's part of the Leeds COVID outbreak plan. So this money can either be used to enhance existing projects that you may be involved in, or to kickstart other projects that you might have had in the pipeline, or you just needed some money to kickstart. But they do need to start pretty quickly. The grants are either of up to 1,000, or for partnership grants up to 5,000, and may be up to 8,000 if it's a particularly good and worthwhile partnership effort. So those details will be on the Leeds Older People's Forum website tomorrow and on the Forum Central website as well. The deadline will be midday on the 27th of January, so it's a very quick turnaround. But the form should only take you about half an hour, absolute max of an hour to fill in, really. It's pretty straightforward.
That's fantastic, Ali. And obviously building on, some of the other grants that have been funded to culturally diverse faith organisations, young people's organisations, really important piece of work. So thank you so much, and flagging that is really important. And that fast turnaround is a real opportunity for people to think about what's needed here and now. Catriona from BASIS, welcome.
I'm Catriona, so I'm the Systems Change Worker for BASIS Yorkshire. I'm filling in for Amber, who I think normally attends these meetings. So just a quick update from us from the Young People's Project. And we've got some service users at home, some are still in school. Isolation is having a significant effect on mental health, as it has been throughout. We're able to visit if necessary, or arrange a visit in our office, but only if absolutely necessary. In terms of the adult team, there's still continuing concern around mental health and isolation, of course. We're offering substantial support, so that includes the food vouchers and food parcels as well, wellbeing packs, helping with utility bills and digital engagement. We're able to do limited visits in home again and the office, but only if absolutely necessary. There's also significant concern around universal credit benefits going down after March. And then in terms of COVID, there's quite a bit of concern around myths of the vaccine and vaccine scams. I think there's one about people dressed up in uniform offering vaccines for £100. So BASIS is going to be doing some health awareness program, trying to disseminate information, a bit of raise awareness, do some myth busting, and then we'll share any feedback received about that.
Excellent, thank you. That's so good, and that's such a great example, that kind of myth busting work based on the very direct experiences that you're having. And universal credit is an area of huge concern, I think, for lots of people, isn't it? It's that we know that 6 million people nationally are going to get further and further into debt, and huge concern. So thank you for raising that. Thank you. Caris next from Society for Deaf and Blind. Hi.
Hi everyone, I'm Caris Green from the Leeds Society for Deaf and Blind People. I think for us it's got a similar messaging really around things like the communication, and obviously making sure that that's accessible, linking in with some of the comments there about the myths. There's lots of sort of myths being spread and lack of understanding around some of the facts behind things, so we're doing some work around that at the moment. Unfortunately we have had to close the centre again. We managed to stay open for some services during the last lockdown 2, but I think it was felt this time it wasn't as appropriate, so everything is closed down again, sadly. But we are this time still continuing with the medical support and providing interpreters face-to-face where needed. We've been doing some work with the hospitals around the clear face masks, which has been an ongoing challenge really for the community, particularly the deaf community and those who lip read. So we think we've made a bit of progress on that now, and we've got some access to some what we're hoping by the end of this month will be medical grade clear face masks, which will make a massive difference. So that's a positive thing, and I think other than that, it is just really continuing to provide the communication and support wherever we can, and still providing things like the befriending services and things as well.
Yeah, thank you. And yeah, those different challenges with this lockdown are really important to acknowledge, aren't they? Chris next from the CCG. Hi.
Morning everyone. Thanks for that update, Pip. That was really helpful. I don't have much more to add to that, but I guess life goes on outside of COVID. So there's a number of things that we're picking up that aren't COVID related. So one of our GPs has just handed their notice in, so we're having to close a GP practice and trying to manage an engagement with people who are digitally excluded. That's providing a real challenge for us. Yeah. There's also some work going on around community mental health services as well. And we're doing some engagement around some changes to that. And then alongside all of that, we're responding to numerous inquiries around the vaccine. So that's keeping us quite busy. So yeah, that's what we're up to in the CCG at the moment.
Thank you, Chris. Damien, Men's Health Unlocked. Hi.
Hello there. Hiya. Hi, everyone. Yeah, I suppose my update would be, apart from the usual, what you would expect from issues around digital exclusion, which of course stretch across the board for lots of different people. We had our first network meeting last week. We had over 50 different organisations come to that to talk about approaches to gendered health inequalities in relation to men's health. And the issues that came up there, again, like I said, digital exclusion featured very highly, as you would imagine, people being isolated, as you would imagine, too. The general reports, one lady who is supporting that something like 50 or 60 different men from minority ethnic communities, saying an awful lot of them are really down, isolated, lethargic, not sure what to do with themselves, and in quite bad ways. We talked about the need for peer support and how difficult that is in the current situation, and men respond very well to opinion leaders and getting that sort of extra encouragement from their friends and confidants. So the difficulties around the lack of that as well. Also talking about it was mentioned, the overrepresentation of Black minority ethnic men in mental health services, but they're underrepresentation in terms of what's provided for them. But really, of course, the biggie is the same for everyone. It's isolation, it's reaching out to people, it's supporting them to get out and just do things that are healthy for mind and body. Okay, thank you.
Yeah, thanks, Damien. And yeah, that importance of reaching out, and that's the absolute value of what everybody here is doing, is keeping in touch. And how brilliant to hear that you had over 50 different organisations at your event. That's amazing. Emily from Women's Lives Leads. Hi, Emily.
I just want to say that firstly, I think that there has been a slight shift in terms of the vaccination and the attitudes towards it with women. I know it was quite poor, but I think the shift is to do with the Oxford vaccine now becoming available. So perhaps some prefer that option to the Pfizer vaccine. And then the second thing is obviously our huge rise in cases. And I think people are starting to shift ever so slightly and starting to think that the risk of having a vaccine is less than the risk of what might happen if you contract COVID. I still think there's a long way to go with that. So we are still hearing a lot of myths and things like that. And we need to do a lot of work around that. But I do think there is a shift. That's what, we've been hearing. We're going to put out a bit of a poll question to find out about that and see if we can get any more feedback around that specifically. Some extra stuff around sort of going into the third lockdown around face masks as well, and sort of more in-depth information about how to use them and to use them more regularly. I know that's coming through as well from government centrally around sort of are we going to move towards more face mask wearing outside as well as indoors. But there's certainly kind of within our organisation, so for example at Leeds Women's Aid, there's more information about where to use a face mask, how to use a face mask, and more detail than that on that. So they're the main key points, I think, from us.
Thank you, Emily. And yeah, some really important issues around some of those shifts and important things that we need to think about around kind of face masks and different ways that people can work with those things. Jane, actually, I've got Jag next.
Just on COVID, just echoing some of the conversations we've had with some BME members, and certainly I'm quite shocked at the resistance still to take the vaccine, and some of the excuses for Chris from CCG I'm getting. What's in the vaccine? We're going to wait for the others to get it and see what happens to them. There's chips in it. So I've said, do you want a BMW chip in it so you can go faster? There's those sort of myths that still are quite worrying. And some of the people we've spoken to are like nurses, BME communities as well, who are even saying they're not going to take the jab, and given there's no compulsion to it. So there are a bit of worrying noises we're picking up. And it's not just from a few, it's actually from, I'd say, 100% of the people we've spoken to. And it's quite worrying. So just to feed that in. On a positive note, the work that Health Watch has been chairing and Chris and other partners are on around digital. That work's picked up some good momentum, and tomorrow I think we've got a meeting that I'm trying to attend. We've all echoed difficulties people are having, so some of the comments made earlier around digital inclusion being considered. I don't think there's anything else I can add to that, but hello everybody.
Yeah. Thanks, Jag. And those are really important issues. Obviously, the Health Watch, there's a detailed summary that if people haven't seen that, of some of the different sort of trends in local views that we can share. But yeah, it's something we all need to kind of be aware of and keep, challenging and being positive and give some positive messages around, isn't it?
Pip, if I can just promote, I've put on the chat, please.
Yes.
The next community forum meeting is the 21st of January. It is
Brilliant.
for all communities.
Yeah, so if people plot that on the...
Please, if you can attend and circulate widely, we had 93 people. All the representatives from adult social care directors were there. Pip, Hannah was there, other members were there. Stephen, I don't know if you were there, but if we can make our efforts to encourage people to participate. In the climate of Zoom, 93 people, it was noted, was a good attendance.
Yes, and I know Simon Cludray came and gave some overview on the vaccine, didn't he, at the last one, which people found really helpful as well.
It did, and it was very well received.
Jane from Homestart. Hi, Jane.
Right, Homestart, we are still open to referrals. We are still supporting families. Unfortunately, it's had to go back to virtual support or telephone support from volunteers, unless the volunteer is the only person who has contact with that family. And we have got a couple of families that, are totally isolated, got no other support. So they are able to still meet outside. As far as our office goes, we are still open because we'd set it up as all COVID safe, and we do all the risk assessments before anybody even does a doorstep visit or anything. But because of the latest strain of the virus, whatever you want to call it, and because it seems to be, so virulent and people catching it, we decided to keep it to a minimum of 1 or 2 people in the office at any one time. So if anybody, there is a mobile number, if anybody has any difficulty contacting us, we are still open. It's just a skeleton staff in the office. Again, it is about isolation and, straight away last week there was, the lockdown, and then the child, children not being able to go to school. So again, it's all the strains there. What we've been trying to do is encourage people, because there are some people that we're working with who are on the vulnerable list, and we have encouraged them to, when their sort of vaccine appointment comes through, to attend, because there are still worries about it and everything. Again, I think what other people have said, it's about enforcing the mask, wearing of masks and things like that, and people just looking after each other, really.
And really important, I think your particular sort of place here is around single parents, and that is a huge extra challenge for people, isn't it, to manage the practicalities.
And even within, going back to staff, I mean, quite a lot of our staff have got children, maybe 1 or 2 children at home. It's the first member of our staff that's contracted COVID over the Christmas period. Well, it was just into the new year, and again, it's sort of brought home. She is a young person; she's only in her late 30s. It's had a real effect, and it's been it's a heart rate. So again, it's about just being mindful and being as flexible as we can, as working.
Thank you, Jane. No, really helpful, and an important reminder about the practical kind of impact for people with young children, especially. Nicola. Hi, Nicola.
So I can sort of touch on what Charlotte, when you went to her earlier, because we work for the same organisation.
Cheers.
Yeah, we're part of, myself and Thomas as well, Gaffney, who's on the meeting as well. We work for Leedsgate, which is supporting gypsy and travellers. So at the moment, I think just touching on what everybody else has said, there's a big sort of worry about myths with our community, and, you know, wanting to accept the vaccine. So our sort of aim at the moment is to do a piece of work to sort of make, you know, educate our members about what the myths are. So I think we're looking at doing maybe an animated video and just getting some feedback from our members to see what, you know, what their questions are about the vaccine. Because obviously things are changing quite quickly. So that's our main kind of project at the moment. And just picking up on the issues around digital inclusion. I know Leedsgate have done quite a lot of work around that, but we are looking at getting laptops and things like that just to kind of support our members further. Because I do think with another lockdown, mental health is going to be a bit more of an issue. So we'll just be carrying on with our welfare calls to all our members, and just checking in, because we're not doing any outreach at the moment unless there's something that's urgent. So yeah, that's where we're at the moment with it.
Oh, that's great, Nicola, and really good to hear that you're thinking about that visual content, because I know how powerful and successful that was initially, alongside the work you did to make sure people had access. Yeah. So yeah, no, that's really important. And mental health, absolutely. Thank you for raising that important thing. Mm-hmm. Thomas, welcome. Anything to add? Really good to see you as well.
Yeah, thank you. In regards to this project on COVID, that is on the back of the funding that we've got from the public health. So, like I say, things are moving very, very fast. We've been told, obviously, that has to be used by March. So we've got a meeting this afternoon with our members to start pulling things together. And one of the biggest things is around all these myths. Some of the stuff I've heard, it's kind of laughable, really, you know, what they think is, but that is the reality. That's what, you know, we've never been in this situation before. In regards to our members, they're very, very reliant on our service, and our office has had to shut down, which is a shame. So lots of welfare calls. I think we did say we would open our hub for our more vulnerable members with serious mental health, because I know some of these rely on like mental health cafes, which are there running now. But I'm glad I've come to this meeting, because there's a couple of forums obviously I've been made aware of now, which I'm going to obviously pass on to our members.
Excellent, that's great. And yeah, do put your contact details on the chat, and other people can link with you as well. You're so welcome. Thank you, Thomas.
Thank you.
Sam, hi Sam from Migrant Access and lots of other connections.
Hi everyone, I'm Sam Powell, I work for Leeds City Council's migration team. Just a few brief updates. The Community Connectors project that works with vulnerable migrants are identifying the issues around digital access. But when there's a number of children in a house that might be overcrowded, some of the additional pressures and challenges that go beyond actual equipment and data. Visas are up for renewal for some clients, is what we're seeing as a bit of a trend. In the Migrant Access project, there are lots of concerns that have been discussed about vaccinations and being chipped. In a number of meetings I've attended, there have been reminders to be careful around the language we use in terms of stigmatising certain communities as being less likely to take a vaccine or more likely to be spreading the virus. So we're having I think the conversations need to be around how do we tackle where people's perceptions are at? How do we help them move closer to considering it? So we've applied for some funding from the Ministry of Housing, Communities and Local Government, and the priority is to work with community champions, targeting the BAME and disabled communities. So hopefully we'll get a positive outcome on that and be able to work with communities in dealing with the challenges. The Census 2021 is on the horizon as well, and that will be a challenge for some of the communities that we work with. Asylum continues, people continue to arrive in the UK, all over the country, and again, we're in a lockdown, which creates some issues. Lastly, on COVID, a number of organisations have shared with me there's a lack of understanding of the third lockdown. We understand the third lockdown is more like the first lockdown. So we've reviewed all our resources to see what we can reuse. I think a real challenge is the message just changes faster than we can sort of keep up with it. And we're looking this afternoon with colleagues in the council and in the region about what can be done with the third lockdown messages.
That's so helpful. Thank you, Sam. Really good to know that you're on with those resources. And I'm sure if there's anyone from this group that can help, if there's anything in particular you need, let us know. And equally, you know, we will absolutely help to disseminate and share and make sure people get to see those, because it's invaluable actually having those, that thought going into what the messages are and helping to get those out. Yeah, really comprehensive. So many things you've raised there. Thank you for that. So next, Anne, who's listed as training, which is why you're coming late in the alphabet for me today. Hi, good to see you.
Hiya, I'm Anne Crossland from Young Lives Leeds. I think the thing that's coming through for us is organisations were just starting to be able to do socially distance meetings with some of the young people, and obviously that's now stopped. There are some real issues around mental health. Some young people didn't access virtual sessions. They wanted to wait to have face-to-face sessions, and obviously that will change. Some organisations were working in schools and getting high referrals from especially young males, and obviously that will now stop because they won't be going into schools. One of the things that we're doing, and I'll be able to share with all of you, is we've been working with a guy from Leeds University to look at the language around artificial intelligence and what the messaging is. So really to capture the views of young people of what their experience has been of lockdown. And it's simply 4 questions, and we're asking them to either send some words in, or for organisations to be able to have a conversation, and we'll be able to just transcribe that information. But that's just happening. So I will share, because I'm mindful that there will be lots of organisations that are working with young people that may not be Young Lives members, but have lots of information that they can help us with. So as soon as that's available, I'll share it with you.
Brilliant. Thank you so much, Anne, and really good to kind of share things. Anything that goes onto the chat, we'll make sure we share around with people. So yeah, do stick it in there. Sorry, my alphabet as ever's gone a bit awry. Simon from the Faith Forum, welcome.
Yes, hello everyone. So a couple of updates from the faith sector. The first thing is, one thing that I've noticed with this third lockdown is that places of worship are really facing a big dilemma about whether to open or not, really having to revisit their risk assessment and really think about whether they need to open. That's the first thing that we're finding. The second thing is, and it's something that came up last night when a few of us in different faiths were talking, and that's about building trust as far as vaccines are concerned. And one thing that was spoken about is maybe some faith leaders coming together to maybe record a reassuring video about vaccine is safe, it's beneficial, all the advantages behind it, including, you know, it's in some ways it's more important than maybe keeping, you know, religious obligations. And so don't feel you have to go to, you know, Friday prayers or go to the synagogue on a Saturday morning if you're invited to have a vaccination. And possibly the video may reinforce the current guidance about staying at home. Then the other thing that came up was about young people as well, and maybe the faith sector doing some work maybe with young people, led by faith leaders. One thing which is happening is a local mosque are rolling out, it's like a short program to do with debating skills, really just to reinforce any other work which might be taking place remotely in terms of building kind of these soft skills, these interpersonal skills that I think the kids might be missing out on by not going to school. So that's some of the things that's happening at the moment.
Thank you, Simon. And yeah, the role of faith organisations and those trusted local groups, really key. So thank you for, kind of keeping that on our agenda. And again, anything more we can do. I know we've tried to reach out to faith groups in a number of different ways, and it might be that there's a bit more time and headspace for people kind of at the start of the year to do that. Wendy, welcome from AdvoNet. Hi.
Hi. So Advocacy Services have had an increase in referrals across most areas. That continues. We're linking in with regional advocacy services about making sure people's rights are maintained during this time of increased pressure on health and care services. Our Leap One service continues to work as part of Aladdin on the digital inclusion work, and wider work in terms of linking in people with learning disabilities who are increasingly isolated as most of the group support has ended. Our Asking Youth services continue to work with Aspire and other consultations.
Yeah.
Our AIM service is working on new resources, focus on mental health. That's why Owen's not here. He's preparing for some training with Engage Leads and prepping for some work with the LCP on access to health services. That's a quick summary since the last.
Yeah, no, thank you. That's really good. And that training and kind of reaching out further is I know, such a critical part of what you do. So thank you for that. Errol, hi. Sorry, we started at the beginning of the alphabet. Are you?
Yeah, thanks
How
so
are these
much.
lads?
Apologies for coming in late.
Not at
just
all.
had a vaccination. So, and it doesn't hurt, and you don't grow a third head as Damien Daughtry was trying to claim, but it's definitely worthwhile. Two things. One is that there's still a lot of concern amongst dads in terms of the validity of the vaccination. A lot of people still unsure about it. A lot of people not quite understanding it. And second thing is we've had to change, as everyone has, our structure to function under COVID. And one of the things that we were doing was dads and kids walks, and we decided to restart them just after November, after the clampdown, and they went well. We're getting up to 28 dads being with their kids, so it was quite successful. And we were walking within groups of 15 dads and children under 5s, which is the government guideline. But we were told because of the recent clampdown, we stopped. And we've contacted Janice Burberry from Public Health as to whether we can continue under the current situation. And she's come back to us and said, yes, you can go ahead. However, some of our members have been concerned as to how it would appear if you saw a group of 15 dads plus the children with them under 5s. Walking as a group, obviously all safely distanced, and it's all outdoors. And we'd ask people to come to their local parks, not sort of like go from Otley to South Leeds or something like that. But we are a little concerned as to how that would appear, how that would look into
Absolutely.
in the public.
Yeah, no, I think you're right to be extra cautious on that, especially, as we've said earlier, the extra virulence. I'm really conscious of time. I know Jane wants to come in, and then Carl and Gabby haven't spoken, but we've also got Rachel here, who's going to give us an update. Welcome, Rachel, on clinically extremely vulnerable. So thank you, Errol. Really good to kind of hear that work that you're doing, and any support again that we can give around that.
Yeah. I just were wanting to comment on that, because we've had direction from Home Start UK that actually we can't do that.
I think
so maybe it's but anything that we can have a conversation about, but yeah, that's why we've gone back to what we have over Zoom. And yeah,
and I think being extra cautious just for the next few months is absolutely the right thing, isn't it? Gabby and then Carl briefly, and then we'll come to Rachel.
Hi everyone, lovely to see you all. So I work at Forum Central with Pip and Stacey. My work is around representation. So it's ensuring that parity of access for the sex representation, and also engaging with current reps. So I'm happy to talk about more. I'm conscious of time, perhaps at another meeting. I'll also put my email address in the chat if you'd like to link in with me directly.
Thank you, Gabby. Stuart, I'm aware I've not come to you, but you've got a slot on the agenda, so leave it for that. Carl and then Rachel.
Thanks, everyone. So for those who don't know me, I work within the LCP, supporting the development of those structures and enhancing the voice of the third sector. So across the 19 LCPs, all are still continuing to meet. There's been a shifting focus towards supporting primary care networks, GP practices around vaccination and communicating messages around vaccination. Also coordinating volunteers and transportation to vaccination sites, as well as continuing to do the core streams of work within each of those LCPs. There's also been a kind of shift to kind of a peer support role as well within the LCPs, sharing information and ensuring that organisations are working cohesively at the local level. If anybody wants to pick up any conversations around LCPs after this meeting, please do drop me an email.
Brilliant, and yeah, really important mechanism, and never more needed, that kind of local partnership. So thank you, Carl. Rachel, you're very welcome. Thank you so much for joining us.
Yeah, so Rachel Loftus. My job title is Head of Regional Health Partnerships because I normally work across West Yorkshire and Harrogate between NHS and local councils. But for the last year, let's just go with year now, it's easier to say, I have been the city lead around shielding and advice for clinically extremely vulnerable people. So I kind of wanted to dip in today. I've got some slides I'm going to share, but I'm hopefully not going to bore you to tears with them. So just to kind of obviously reiterate, the advice at the moment to clinically extremely vulnerable people is to shield at home. So we've done a summary of that advice, and we've now got that available in a number of community languages. The list of community languages is there, and Lithuanian is not on that list, but I'll have to include it. If there's any other languages that you require, please do ask, and we'll send out the bundle of those across to you later today, so that we've got that information available. I just wanted to kind of just put a bit of context though in the reason around shielding advice. So it's about 37,000 people currently in Leeds who are following that advice to shield, but only 5,000 of those have registered for support. If you look at that compared to last year, when we had about 23,000 people registering, I am worried that the change in policy that there was since November, that people have to register online, that the support offer isn't as clear, is having an impact, a significant impact on people asking for help. I think we are very lucky in Leeds that we have worked as a city, as a system, as partners, to provide a really comprehensive offer that's very person-centered, that just basically enables anyone who's advised to shield to provide them the support to enable them to follow that advice. So I just wanted to point that one out. And unfortunately, I want to point out the other side of that, which is the reason why this advice is so incredibly important is, thankfully, due to the fact that many people followed shielding advice earlier in the year, there was a smaller proportion of people who were CEV who got COVID-19. So that's really good. That shows that it worked. But for those that did, 16% of them have now died. Now that's of all causes, and obviously clinically extremely vulnerable people. But that's 16% of the people who had COVID and were clinically extremely vulnerable have now died. So that we can't overstate the importance of enabling people to follow this advice and be risk aware. I don't want to alarm people, and the good news is that when the people follow the shielding advice, fewer of them get COVID and are exposed to it. But we do need to just kind of keep reiterating that shielding saves lives. Shielding is not good for your health, but neither is being exposed to COVID. So we do have to, my rallying cry always is to our city, to our partners, is whatever we can do to help people do this well, to do it physically and mentally well, we should and could do. And obviously the other bits of that is, the very realistic thing is that 28% of people who are CEV live in areas that are ranked as most deprived, and therefore the highest number of working age people live in those areas, and therefore we also know the highest number of people who don't have the option to work from home and stay safe also are in that. So as with all the things that we know, the more of the factors that apply to your life, the greater your risk is to this virus. Generally, the CEV population mirrors the city's ethnic breakdown, but as you can see, again, 7.7% is unknown, and we know that unknown is largely going to be found in non-white British communities, not in white British. So again, the inequality even of data is very apparent. I won't talk to those slides. I think this one's the easiest one for people to kind of understand, which is CEV people come in all shapes and sizes, all age brackets, all demographics, but all of them will have that need for clear information in accessible formats, and that's accessible formats to them, not accessible formats to us to produce. So we do have to keep pushing that, and then many people will need to be signposted to the support, and that will either be to local volunteering, to existing support, that kind of stuff. And only a small number of people will require direct assistance to follow that shielding advice, but for those it's very important that we get that right. So I think that the kind of earlier in the year, the kind of attempt by government to kind of provide a food parcel to everyone in this cohort just didn't meet with what people actually needed. But I'm also then worried that we've got that great offer for anyone who does need it, and that might have been diluted by the fact that policy has changed. So the easiest thing that we do is say to everybody that the helpline is the easiest place to triage. So we want there to be a no wrong front door. So if anyone comes to any of you guys, the fact that you've got routes to support available and any documentation means that you guys can signpost, and that we want that to continue. But if in doubt, kind of going through the helpline enables us to triage into those core places and spaces. And you can see there the kind of that's generally around social care, financial, food, pharmacy, finance, friends is my my mnemonic for remembering that, but also kind of anything else. So we've got lots of people who will not fall easily into categories. So for example, they might be the parent of a CEV child, and their workplace isn't enabling them to follow the shielding advice, for example, or you've got other complicated or complex factors, and so we will just take any of those, and they if you go through the helpline, they generally end up coming to me or someone in my team, and we can always sort that out. I did want to just run through that quickly, basically.
Thank you. That's incredibly helpful, Rachel, to get that overview. Obviously, we can share these slides afterwards, so we'll send those out. And what we could perhaps also do is just share, I think, hearing you say that, maybe if we just make that bit of clip available to people, because I think the way that you point some of those kind of key areas, about the inequalities of data and not overstating the importance of that support that's available, but also particularly for this group and so many others that we work with, that sense that if people come to any of us, we can all share this information. And the fantastic Routes to Support document that you've produced has been a really comprehensive kind of pulling together of that. So if anybody hasn't seen that, we'll make sure we send that again. But I think, again, it's that sense that all of us working together to make sure that we're giving that really important message that people who need to shield, shielding is isn't great, but it's so much better than the alternative, which is getting COVID. So yeah, really brilliant opportunity to kind of hear you talk through that. Has anybody got any questions for Rachel or any comments?
I do have 2, possibly 3 things to ask as well, of you guys.
Excellent. Damien's got a question, and then we'll come back to you, Rachel, for comments. Thank you, Damien.
I just wondered if there was that deadline, wasn't there, in sort of September for registering for shielding. Do you think some people might be thinking that they've missed the boat now and can't sort of re-register?
Yeah, so I think the fact that the new system is purely online, so I think that's put an awful lot of people off. I think people who kind of thought they missed it, registered, have put other things in place, are just kind of largely getting on with it. And I do think the comms around that period of the end of July, beginning of August, a lot of people just kind of felt like that they were being betrayed, really, that the support that had been there was being removed too quickly. So I think a lot of people just kind of have put their own arrangements in place, and and that's good, and absolutely it is the right thing, that everybody does the right thing for them, that they know the advice and they tell it to their own lives. That's absolutely what I always want. I just worry that those people who might benefit from support or are putting themselves under considerable financial strain, emotional pressure, practical pressure, and could get help if they needed it, aren't accessing it. So yeah, I think it's a combination of all of those factors, but the one that I do worry about is the fact that it's all in English and all online, in terms of that first line to direct people to registration.
Yeah, really important point, Damien. And again, I think if people are concerned about any individuals, it's about flagging that and picking up the phone and making sure that we're kind of raising that where we can. Sam.
Hi, Rachel. I was just wondering whether the information that was collected previously with people registering wasn't used in terms of helping people with that process now, and how do we mitigate against those challenges of people accessing? And lastly, the type of support that they can get, does that encourage them to then register?
Yeah, so I think so obviously what in terms of the previous registration, I would say we used it really, really well to target and to try and make sure that offer of support was there. Obviously, those people who registered for online supermarket access retain that. So for many people, that priority access to supermarket delivery slots has been retained, and therefore they've not needed anything else beyond that. So they haven't bothered to re-register. Or as for most people, they think they've already registered because they did it once, so they don't recognise that it's a separate system. So there's a whole set of inequalities around that. I think with the routes to support, as soon as this new registration system was in place, we made sure that we were basically encouraging anyone who works with anyone, asks if they need a hand to register. So it's available through the helpline. You can phone up, you can do it through the different languages support. So but we know that's not enough. It's one of those things, it's that mitigates against the fact that that this has been missed, because you still have to ask someone to help you to do it. It doesn't enable you to do it for yourself, and the conditions aren't in place for you to do it yourself. So so on the one hand, yes, I would say we've got strong mitigation and we've enabled people to do that, and people are coming through asking for that, and that's good, and we could do it. But if you asked me if it was enough, I'm going to say no, but we're working against a national system in that respect. It's not something that we've got control of. It's not something that we've influenced it a little bit, but not control of. And then I think that third part of your question is also because essentially the national system currently, it's priority supermarket delivery, or do you want a call back from somebody locally? Even though that's really good, because what it means is it's not prescriptive. So I think before there was this this question that was asked around care, and I think a lot of people were confused about their care needs. So I think a less confusing question is very welcome, which is, do you want someone locally to call you back? But I think if they don't know the level of support that we've got available, the flexibility we've got available, again, that might not encourage people to do so. So I think a lot of people are just kind of muddling through
and putting a lot of pressure on themselves, quite frankly, financially and practically, without realizing that maybe they could ask for help. So that's why we need you guys to make sure that that's a really warm offer, and we'll work with you from where you're at and what you need from us.
And I know I'm just really conscious of time, Rachel. I think one of the other asks is for people who are experiencing being kind of on the clinically extremely vulnerable list to come forward, isn't it, to share views and to link in. So if anybody's aware of people that be willing to be part of that project, let us know. I'm just conscious we need to go to Stuart from Health Watch, just to give some time for him to give that update. Was there anything else, Rachel? I know you'd got a couple of things.
One was mental health. So we can come back and talk about that another time, because I'm just really conscious of that. Yeah. The trauma of shielding and the long-term impact of that on people's long-term outcomes. So it's more of a long-term, because I think we've got emergency support in place, but that's something I'd like to come back to. And the other one was just around financial support, and if there's anything else that you guys think we could or should be doing to do that. And I'll put in the message chat the link to the webinar that we're holding in February.
Perfect. Thank you, Rachel. Brilliant, really helpful. I think everybody, just really appreciates you coming and giving us that kind of really direct message, Rachel. So thank you so much for that. Stuart.
Oh yeah, thank you. My name's Stuart from Health Watch. Really interesting to hear what people have been talking about, especially around the kind of myth busting element for vaccinations. And I'm thinking, it looks like a lot of you are probably going to go off and do your own thing. So it'd be really useful kind of to share that with this group. I've seen a few bits out there. I shared something recently with People in Action around learning disabilities, and a piece of work, a video someone had done explaining their vaccination to people with learning disabilities. So what I'll take away from this, I'll reach out to our kind of National Health Watch network as well to see if they know of any kind of myth busting videos that are out there that will be really useful for different communities that I can share with you all as well, because I don't want people to be doing unnecessary work. There might be some really good stuff out there already. So I'll take that away and do that today. Just quickly, some of the work we're doing. We're doing some work around health literacy in people with long-term conditions, and work around end-of-life care in the community. So this is people who have died or receive an end-of-life care in care homes, hospices, or at home. Some really emotive, as you can imagine, stories coming from that, and experiences. Some really positive as well. So I think what this is highlighting is the variance in care that people are receiving, especially in care homes. And we found this with all the work we've done with care homes. A lot of it is down to the manager in the care home. If you get a really good manager, you tend to get better care. And if you haven't, then it can be disastrous for residents and family members as well. The Inclusion for All Hub is still going. So over the last year, we've done a lot of work around the Accessible Information Standard, focusing on people with sensory impairments and learning disabilities, autism. So there's a lot of good background work being done by provider organisations around that. The next focus we're going to have is going to be around language barriers as well. So I'll share some more information about that when we start doing that. We're doing the real-time experience videos still. And I'll just quickly talk about some of the inquiries we've been getting, because I think Pip touched on around the local variations around vaccinations. We've started to get a lot of inquiries from people around their elderly relatives, not having enough information or worried that their friends had the vaccine, but they haven't as well. So we're going to make sure we feed that back. And I think there maybe needs to be some clearer information on websites maybe of GP practices. So we're also seeing more people get in touch with us around accessing GPs and appointments. That seems to have got worse recently as well. It's never been brilliant, but it seems to be worsening. And the ongoing thing we're getting is still around dentistry. It's got so much worse now that dentists are operating at 20% of previous capacity. For someone to find an NHS dentist pre-COVID was bad, but now it's nigh on impossible. And now people are even kind of struggling to get urgent treatment. People's teeth are falling out, they're in severe pain, but they're struggling to get seen. But we're working with the NHS dental commissioning team, but this is more of a national thing for us. So that's kind of some of the work we're doing at the moment. Quickly talk about the next weekly check-in. Just want to give you a heads up that we'll be running a month-long check-in this time, focusing on mental health. In the first 6 months of COVID, in pretty much every call we made or thing we heard, and again, it's happening now from what you lot we've been talking about, mental health is one of the key issues. So this one's going to focus more on what it's like accessing mental health services. We've developed the questions with the mental health commissioners. So we've just had feedback this morning, so hopefully I'll be able to share them with you this afternoon. So it'd be great if you could share these with your communities, but also get in touch with us if there are any specifics you want us to include in the check-in summary that we do at the end of in a month's time, or any pieces of work you're doing around mental health that you'd like us to highlight in that summary as well. And then the health inequalities work. I think you've been emailed about this before, so you may be aware about it, but we've been speaking to organisations about some of the specific health inequalities that your communities you work with are facing. We're asking a few questions such as what could health and care organisations do differently? What would amazing look like? Is there any research that we could share and examples of good practice? So at the beginning of Feb, we're looking to put a report together with a couple of pages per community. There'll be a bit like fact sheets, and they'll include the population size for that community and any other kind of demographics that will be useful. And the end product, we hope, will give decision makers an idea of how big that community is, what the issues are, what might work better, and who they can link into as well. So I think the real positives from this will be sharing your experiences of good practice and what you think. There might be some really quick things that could work differently or be improved on. So please get in touch with us if you'd like us to interview you for that. You can contact me, Hannah, or maybe through Pip as well, if that's okay, Pip.
Yeah, of course. Brilliant. No, thank you so much. That's really great, and so complementary to the work that you're all doing and that Stacey's leading through the outbreak plan. Being able to capture and draw together information and make sure that it's heard. So Stuart mentioned those interviews kind of feeding in. So a number of people, including Owen and Carers Leeds and Lassen and a few other organisations, fed in to the Health Improvement Group, which is links up to the Partnership Executive Group, and people came and spoke very directly to people making decisions. So making sure that we've got those channels and opportunities, and I think Healthwatch have played such a key role at helping us distill that information. So massive thanks, Stuart, to you and everyone in the team for really kind of keeping on track and finding mechanisms to draw together the knowledge and expertise from people. Does anybody have any questions or particular comments that they want to make to Stuart? I know I'm kind of seeing nods and smiles and people really valuing that work that you do at Healthwatch. Brilliant. Thank you so much for gosh, what a kind of rich and diverse range of perspectives. Incredibly helpful to kind of hear all of those. Really important for you to know that what you say here is obviously captured and shared. It's really great to see the connections and people making that point that this is making you aware of each other kind of resources, and really helpful to kind of know that people are linking things in and sharing, but also that we're taking issues from this group into other forums and making sure that we're building that conversation and bringing that response back. I don't know if there's anything in particular. We've talked about perhaps mental health and people who are clinically extremely vulnerable as something we could talk about at the next meeting. And my sense from how important mental health is for people is that would be welcome. If people have got other suggestions of things particularly that people would like to get covered, obviously we'll have more information around vaccination, which will continue, I think, to be really important for all of us. If there are other things that people would like us to put on the next agenda, then do let us know. Either stick your hand up now or put it in the chat. And it would be great if any of you would like to chair the next meeting or one of the subsequent meetings. One of the nice things about this group is that we've rotated who's chaired and kind of led the discussion, and it gives different opportunities for people to do that. So we'd be absolutely delighted if anybody's up for doing that. Just let us know.
Could we add on to the agenda, following on from what Stuart said about the sharing of resources? You know, Leedsgate were talking about doing an animation that was myth busting that might be really useful for loads of other areas. Could we look at a way we can do that more systematically, that we know what each other's thinking of developing, we know what's available nationally, and we're sharing those resources, or we're planning to do things together? I just feel that people might put quite a lot of time into things, and it would be really useful to know what's going on and plan that.
That's a really good idea, and perhaps we could get a bit of an update beforehand that we could share, so we've got, that people have kind of fed in. Carl did remind people on the chat earlier actually that doing verbal updates, if that's not possible, written ones are always really welcome as well. So perhaps as part of that we could add that as a question. I think that's a really good point, Wendy, because the last thing we want to do is duplicate effort, and where we can share resources that have been developed. I particularly liked Sam's point about kind of going back to resources that had been relevant for the first lockdown and just thinking how they could be tweaked and adapted rather than starting from scratch, which is a really good point as well. So thank you. We'll definitely add that. So we've got 3 potential areas, haven't we, for the next meeting? Are people happy to continue to meet every couple of weeks? Does that work for people? Yeah, seeing a couple of thumbs and nods. Thank you. Obviously, as ever, any suggestions? Yeah.
Can I just lastly, so our webpage, we've now got a share your knowledge for the communities of interest as well. So quite aware that we hold these meetings every 2 weeks, and sometimes people can't get to them. So that is, it's a really short survey just to be able to capture what's happening within your communities, the challenges that you're facing as an organisation, and any successes that you might have achieved. So what's working well, and again, this is something then that can be fed back through the communities of interest, also fed into other meetings similar what's discussed today.
Brilliant. That's really helpful, and good to have different ways of capturing and for people to feed in. So thanks for that, Stacey. Brilliant. Unless anybody's got any final comments, there's been so much on the chat today, so thank you all for putting those. We'll make sure that is shared along with other resources, Rachel's slides, and massive thanks to everybody. Really appreciate you making the time. It's great to see you. I know things are so tough, but keeping connected and the work that you all do is so appreciated by everybody that you're in touch with, but the power of coming together and sharing that, and that kind of wider, the sum is greater than the parts, isn't it? And thank you so much for being part of that and continuing to share that. Brilliant to see you all.
I say, when I talk to people from other cities and other places, they are so jealous of the quality of what we have available here, and that is thanks to all of you guys, like working in the way that you do and coming together. The fact that we can have information in this way, and I just don't know if you know how special you like that really is, but it is amazing. So thank you. I just wanted to pass that on.
Oh, thank you. No, I suppose we don't kind of have that perspective, so that is really lovely feedback, Rachel. Thank you. I think we kind of assume everyone's doing this everywhere else, and brilliant. Oh, lovely. Great. Go well and enjoy the rest of the day. There's a bit of sunshine, so try and get a lunch break if you can, and a bit of fresh air, because we need all the daylight we can get, don't we, at this time of year. Take good care. Look after yourselves.
Bye.
See you soon.
Bye.